I thought you had something maybe you wanted to start with.
Oh,
Uh,
yes. Well, it's been a while since we had one of these
mhm.
podcasts, and everybody's been busy and things have come and gone. And so we are looking at a new year, and we have our, we have a Zoom
Integration
meeting
period.
coming up.
Oh, that's
Where,
right.
yes, we have an instructor
TNS.
meeting coming up, and we have, of course, several integration courses coming up. I've moved offices and I'm very happy with the new location.
That's right. I have to
Um,
come down and see the new office.
yes, inspect
See
it.
where my new office.
That's right.
I have to approve of my new
You
office.
have to approve your new office. You go right ahead. We can't wait. So that's it. But one of the things that has become quite evident, as I said, is that sequencing the assessment process, making sure the rehabilitation process is following a certain algorithm, limits mistakes, errors, omissions, and also allows you to group together assessments to make them more useful, more meaningful. If we go
Okay.
from the principle of that everything is connected unless you can prove it is not, it means, therefore, your assessment must also follow this holistic um, approach that allows you to have a big picture view of the overall presentation of symptoms and history. And from that, you are going to um, slowly peel away and focus onto the diagnosis that is of greatest importance. And that diagnosis is what Yande used to call the secondary diagnosis. The why does this person present with these symptoms?
Sounds like you're telling me that, after I finally have gotten this under my belt and feel comfortable with it, you're once again going to pull the rug out from under me and, and
Not,
just and just really stick it to me.
no, not at all.
Oh, you've been
I,
doing it like that? Oh, I'm sorry. I'm sorry.
I'm not going to do that. I'm going to reaffirm
Okay.
details of what we've been doing. But I think that, for instance, when you are doing range of motion, there are times when you can do the first initial assessment range of motion, which just gives you a broad idea of what the patient is capable of. But then when you start going to the regional areas, then you must have a sequence of tests of range of motion assessments that can narrow down which segments are most limited. Now, this is not so hard in the spherical joints when you are looking at the spherical joints. But for instance, when you look at rotation, spinal rotation, you often have to take into account the fact that the spine is not floating in space. You are standing on your legs and you're rotating your spine.
You're
Therefore,
standing in space and rotating your spine.
yes, so if you stand and you rotate your spine, you can include rotation all the way down to the feet, or you can just rotate from the waist, etc. So when you have somebody rotate right and left, you can then have them kneel, take out the distal segments, and rotate right and left. You can also have them go into like a first position, crouching position, and have them rotate there. And by that, you take out the pelvis. And so
Hmm.
you now have just the spine and especially the thoracic spine or thoracolumbar upwards to rotate. And you can then see what where the limitation lies, because you may suddenly find that you have more rotation freedom in the thoracic spine, but less when you add the pelvis and so on.
Yeah, we had been doing, I mean, we had been doing some of
We
that.
have been doing some of that. And so it is just a progression of making sure that you are keeping a consistent battery of tests and not forgetting to do this so that you can really go, okay, I'm going to work on the hips to improve the rotation of the spine because that's where the problem lies, or so
Right.
on. So that is that. So um, gathering assessments together helps to make more useful conclusions by using a battery of tests. A little bit like what we do with the treatment of wedges. We do them all at once so that we can get a uniform and
Hmm.
cohesive conclusion and result. And so this is also something that is necessary when we are looking at the regions and putting batteries of tests together. Another thing is expanding the or reaffirming the testing of the muscles around the torso, costalis, longissimus, multifida,
Oh boy.
obliques,
Oh boy.
um, because
You're
those
serious
be,
about that, huh?
yeah, those belong to the canister, and you have to test them. Um, so that was another important, um, not conclusion, but reiteration, reaffirmation of certain things that help with with this algorithm and this process of
Yeah,
rehab.
I mean, again, it's interesting you say that now because it's like, uh, in our, from our perspective and in this approach, it's always the principle of, okay, you have the particular region that we're focusing on, at least the proximal structures, the spine and the pelvis, and we will do some manual muscle tests around that, uh, to transverse abdominis muscle test, oblique muscle test. But you're right, we never really go to the back
I
and
know.
test some of the law, the essentially the spinal
That's
stabilizers.
right. And you have to do that. And
Yeah,
I
I mean,
am, we've been, you can get by,
yeah,
but there's a hole, a gap. And if you do not have that information, you may find certain clients who really need to know and really need a
yeah.
regional or localized treatment of these muscles before you continue
Yeah, I
your
mean, it's if it'd be equivalent if you're looking at someone's hip and you only test the
I know.
external rotators or something,
Exactly. You can't just pick and choose.
Right,
Yes. So
right.
we have to be more comprehensive. And so that is something I have. Um, what has been interesting is that many years ago, I would do these tests, but they hung by themselves. They were just remembered to do. Now I go, this is where they belong. They belong with the canister test. These tests belong with the spherical joints. These tests belong in this position, and so on. And it really makes it easier to see the big picture without having to keep on reminding oneself, oh, I should test this, I should test this, I
Mhm.
should test this. Because then it becomes pretty random and you
Right.
can
Yeah, I
easily
mean, I
forget to
remember
do
I
it.
remember watching you go through the manual muscle tests on people. And I mean, you're not saying it like it act I mean, I what I remember was there was an algorithm, there was some obviously rationale
Mm-hmm.
and logic to it. Remember we would you would you would generally externally rotate someone, generally internally rotate someone, and then
That's right.
test the
That's a
external
long
rotators,
time
internal
ago.
rotators. Yes.
Yes.
Yeah.
That,
And I
that
I
was
used to do
something.
that too because
My
Robert
God,
did it.
yes. Oh my
But
goodness.
and then so now, I mean, it is, and again, just putting a principle to it. We
That's
know
right.
we have the principle, so now we can plug in the manual muscle tests that we already know.
That's right.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook at IMTR Seminars.